Well, good afternoon. I want to start today by saying thank you. Thank you to everyone out there, and thank you from the bottom of my heart. It's because of you. Thanks to each of you, we've made tremendous progress. We're flattening the curve, we're heading in the right direction. And as we adjust to the new normal, as we continue to look out for ourselves and our loved ones, as we take the necessary precautions, we have reason to be optimistic. As the trends continue downwards, as we continue seeing a reduction in community spread, we're getting closer and closer to opening things back up. And today, we have the groundwork in place. We have the critical pieces we need in place. We have a framework and targets. We have clear sector-specific health guidelines. And with these critical pillars in place, we are in the position now to look at what we can start to open up safely. And based on our framework, based on our robust health and safety guidelines, it is clear that right now there are certain businesses and workplaces that can operate safely. That means they can physically distance their staff and customers. They can put in physical barriers. They can provide contact-free services, or they work outside and are isolated. We have consulted with our chief medical officer, and today we're able to move forward with opening a small list of very specific businesses. Many of these are seasonal businesses that we're confident can operate safely as long as they comply with public health measures and workplace guidelines. As of Monday, May the 4th, the following businesses will be able to operate: lawn care and landscaping services, garden centers and nurseries with curbside pickup, community gardens, no-touch car washes, auto dealers by appointment only, site preparations for construction projects, and certain essential construction projects such as broadband, telecommunications, municipal projects, and schools. Marinas and golf courses will also be allowed to start getting ready for the season, but not open just yet. Folks, our hard work and perseverance, our patience is paying off. We're at an important starting point, and we should take today as a sign. Today's news shows us that if we stay the course, if we stay vigilant and take the measured approach, we can keep moving in the right direction. We can keep moving ahead with the opening of the economy. We will still have a long way to go. But today is a glimmer of hope, and it couldn't come soon enough. I'm very pleased that we're here today, and I know we all are. As I said on Monday, we're at the start of a conversation, and every step forward is an important step. Every step forward is a step in the right direction. And in the coming days and weeks, I'm hopeful that we'll meet more of our health targets. I'm very optimistic that in the near future, we'll be able to announce that additional businesses will be able to open up safely. People are eager to get back to work. I know that. And right now, our future is in our hands. It's up to us as a province. And when the time comes, we will regain what we have lost and more. My friends, we will get there. We will get there together, and we will get through this. Thank you so much, and God bless the people of Ontario. Now I'll pass it over to Minister Fedeli.
Thank you, Premier, and good afternoon. When this emergency situation began, the business community was ready and willing to step up to the plate. whether donating personal protective equipment, turning their production to the manufacturing of critical supplies for the front line, or submitting proposals through our web portal, Ontario Together. It has been an incredible demonstration of the Ontario spirit. Yesterday, our government released workplace safety guidelines to help employers continue to protect their staff and customers. These guidelines cover a wide range of Ontario's economy and include measures such as maintaining proper physical distancing and the cleaning and sanitization of equipment. These ensure clear guidance and appropriate measures are in place so that workplaces can safely open. And as the Premier noted, today we are announcing that certain operations can begin starting May 4th. And as the Premier said, these include lawn care and landscaping services, garden centers and nurseries for curbside pickup and delivery, marinas and golf courses only to begin their preparations for their seasonal operations, automatic and self-serve car washes, car dealerships by appointment only, construction that supports improved delivery of goods and services and digital infrastructure, schools, post-secondary and municipal construction projects, including transit, site preparation, servicing, and excavation for residential, institutional, commercial, and industrial developments. These changes are in line with health guidance and physical distancing and reflect changes to the seasonality. We are moving responsibly and cautiously because we don't want to jeopardize the progress we've made over the last few weeks. The next challenge for our business community is clear: to make the necessary adjustments to their operations, work with their employees and their customers, and put these guidelines into action so we can protect the health and safety of the people of Ontario. Easing the unprecedented restrictions our government put in place to save lives and stop the spread will be a complicated and difficult task. But Ontario's business community has risen to every challenge presented by COVID-19. And we have every confidence that they will, in the true Ontario spirit and form, rise to the challenge of keeping workplaces safe. Because getting it right will ensure Ontario returns to prosperity in the safest way possible. And now I'll pass it over to Minister Phillips.
Good afternoon, and thank you, Minister Fedeli. I'd like to begin just first of all today by congratulating Tim Macklem, who was appointed the new Governor of the Bank of Canada today. I'd also like to take this opportunity to thank Governor Steve Poloz for his 7 years of dedication, particularly during these challenging times. Steve's from the Durham region, and as the MPP for Ajax, we always like to see a local boy make good. So it was great. Steve joined us this morning to talk to the Ontario Jobs and Recovery Committee, and we appreciate his insights, and it's just an example of the kind of expert advice we're getting in the health area, in the science area, and of course in the economic area. We do wish Tip well in his new role. By following our public health experts' advice, we've made progress in our fight against COVID-19. Our sacrifice is paying off, and we can see light at the end of the tunnel. But obviously that progress has come at a cost, and we all know that families and businesses are struggling. Our government has been there to provide support for parents and vulnerable seniors, small businesses facing challenges to pay rent, and making $17 billion available in direct and indirect support for people and businesses. Government can help, but as soon as it's safe, we all want to get people back to work. While we're not yet in a position to move into that reopening phase in our response to COVID-19, we are a step closer. Yesterday, our colleague Minister McNaughton outlined guidance that will help businesses keep their employees and customers safe when they reopen. And today, we're pleased to say that some businesses are in a position to start following that guidance, which is why they'll be able to start operating with restrictions next week. Our response has always been guided by what makes sense for Ontario, based on the current status of the outbreak in our province. We've always been nimble, making practical, periodic adjustments when it makes sense, for our health and for our people. Thank you very much.
We'll go to the phone line for questions. One question, one follow-up, please. First question.
First question comes from Haley Cooper from Newstalk 1010. Please go ahead.
Hi, Premier.
Hi, Haley.
With all this talk of slowly reopening, we've heard about the need for increased contact tracing. So I just want to circle back to something that you and I discussed a couple of weeks ago, and that was Alberta using smartphone technology to track people with COVID-19. And you said you were going to talk with Premier Kenny about that. And I just want to know how that conversation went, and will the province be adopting that technology?
Well, I had a great conversation with Premier Kenny about that, and I passed it on to our health team. And before I pass it over to the Minister of Health, I want to congratulate our health team, Minister Elliott, and the Chief Medical Officer, but our whole health team. I want to congratulate them on the numbers of over 16,200 people were tested. They promised they'd bring those numbers up, and they did. And now we just have to continue moving forward on that. So to our health team, thank you for such the hard work. And these folks are up all night. I'm taking calls at 11 o'clock at night, talking to our health team, and they're just an incredible team. So I really appreciate it. I'll pass this question over to Minister Elliott.
Well, thank you very much for the question. We have been doing the contact tracing manually, using a lot of medical students who volunteered to come forward, public health practitioners as well, to make sure that we can do prompt follow-ups, to make sure that we can identify and make sure that people who are self-isolating remain in that situation. But we are looking at some apps as well. We are looking at ways to use our technology to increase the volume that we can do the contact tracing on. And we're also looking into the future as well, because we want to use the technology to support our health care system generally, so that when we are through the COVID-19 pandemic, we'll be able to use this application for other uses, following up with people that have chronic physical conditions, to give them prompts and so on. So if they have something like diabetes, to remind them that they need to do their eye examinations and some of the other things that we're doing. So we're looking at some of these apps for now for contact tracing, but also for the future for the benefit of our healthcare system.
And my next question is for the Premier. With rent due today, many businesses are saying their landlords are not participating in the federal government's rent relief program. Some restaurants are saying they're going to have to close their doors for good this weekend. They're now looking to the province to pause evictions for commercial tenants. Will you do that?
Well, we put together a really, really great program with partnership with the federal government of over $900 million, and it's really, really helping both, not only the landlord but the tenants as well. And if you don't mind, Haley, the Minister of Finance put this program together, so I'll pass it over to the Minister of Finance.
Thanks for the question, Ellie. And we certainly are hearing from tenants, from commercial tenants, about their interest in the program. Have to keep in mind, the program was announced by the federal government last week. It's being rolled out by the Canada Mortgage and Housing Corporation, and the program does not actually begin practically on the ground, according to the federal government, until the end of next week. So that program is still being rolled out, although the details are out there. I have to say we've got some good feedback from a number of groups about different things to make it better, and I know the federal government has been very open to those. But again, as the Premier said, we're confident this is over $900 million of support. It divides, as I said, I've said before, it would reduce the tenant's rent to 25%. It would mean that the landlord would get 75%, and then the governments, in this case of Ontario and the federal government, would pick up the other 50. So this program is, again, still the details of it to be rolled out. Again, I know the CEO of Canada Mortgage and Housing is a very competent individual. The program's well conceived, and we think it's going to help probably hundreds of thousands of businesses here in Ontario.
Next question.
Next question comes from Travis Danraj from Global News. Please go ahead.
Hi there, Premier.
Hi, Travis.
Question for you, and then I have a question for my colleague as well. So with these guidelines that you have put into place, I'm just wondering if they're mandatory, what you're going to do in terms of enforcement, and also, as you know, procuring some of these personal protection equipment, things like hand sanitizer, has been very difficult. So what is the government going to do in order to help businesses get some of the supplies they need in order to put these guidelines into place?
Well, the guidelines will be followed up by bylaw officers across the province, along with the PPE. I hear you. It's a challenge. It's a challenge on all fronts. We're seeing more surgical masks coming in. We have domestic supply ramping up as well, and we're going to work as hard as we can to make sure that the businesses have the requirements that they need. But yes, I'm not disagreeing with you. The PPEs are important, very important.
All right, and this next question is from my colleague, Catherine McDonald, who's working on a story on long-term care. The government was sent a letter from families of residents at Meagan Manor, a long-term care home, and there have been various allegations that residents have been pushing their call buttons without anyone responding to them for hours. A family of a 105-year-old woman says that she was left only in a diaper without a sheet to cover her, calling out for a glass of water for hours, and there are many other allegations that have not yet been proven, but the families are demanding that the ministry step in to help deal with this. What is the government going to do?
Well, I'll pass this over to the Minister of Health.
Well, we've been hearing some pretty tragic stories about some of the things that have been happening in our long-term care homes. And we are taking action. First of all, we have asked for the assistance of the armed forces. They have gone into 5 of our long-term care homes with nursing and other supplies, as well as for cleaning and infection control purposes. We also passed an order last week that allows hospital personnel to go in to work in long-term care homes as well. I would say that the hospitals, it's a voluntary association and indication by hospitals if they want to do that. To their great credit, they have done that. And the employee representatives, the unions have been wonderful as well, doing this on a humanitarian basis because we know that they need staff in these homes. We've been working to get staff in there from the hospitals. They are bringing their own PPE in with them. We're also sending in SWAT teams to a number of these homes in order to assist them with infection control and prevention to make sure that it's going to be a safe workplace for people going in. But we know that there are many, many sad stories of people that have been needing help and assistance, haven't gotten it, but we are making sure that they are going to get that now. This is something that we absolutely need to do on a humanitarian basis. And I know that there are many families that are upset about this. I don't blame them, but we are taking action and we are going to resolve this situation and we are going to make sure that there's staff in there to attend to their needs.
Next question.
Next question comes from Mike Crawley from CBC News. Please go ahead.
Hi, Premier. We're hearing from frontline workers in both long-term care facilities and in home care that they're not always getting the proper protective equipment that they should have, especially masks. So we're hearing long-term care workers are not getting N95 masks even when they're caring for confirmed COVID patients. And we're hearing home care workers are being told to use the same surgical mask all day, even when they travel between multiple homes. So what's your response to this, especially given that you keep saying that the province does have, enough PPE available, and they just have to, these homes and home care agencies just need to get in touch?
Well, the management there should be giving everyone the masks, and we do have the supply. We have a system. People, operators, sitting there waiting for phone calls and get the delivery over to the long-term care homes within 24 hours. And we have the supplies, so we'll make sure we stay on that. But again, I'm asking the managers of these long-term care homes. 80% of them are privately run. If the caregivers need masks, give them the masks, and we have enough. All you have to do is pick up the phone, and I'm talking to the managers right now. Pick up the phone and call us, and you see the inventory, and if you need them, just call us. But I'd also call us, keep track of your inventory as well. That's another issue that we face. They leave it to the last minute. But we do have them. We will get them over there in 24 hours. It's critical. The frontline healthcare workers get the PPE that they need. We have it, and the managers, it's critical that you give the frontline healthcare workers these masks.
Okay, my follow-up is on the economy. The C.D. Howe Institute report out today saying Canada's entered a recession. No real surprise there. What's your government's long-term plan for helping businesses recover from the economic devastation? I know you announced some new businesses that can start functioning on Monday, but what extra things are you going to do to help businesses get economically back on their feet, given how rough things have been for them for the past couple months?
Well, nothing as bad as we've seen now, but we were in pretty rough shape when we took over, and we had the economy booming in over a year. And we put incentives in, no matter if it's reducing WSI premiums, if it's reducing electricity costs now, making sure that we give a tax break to hundreds of thousands of small businesses, which we did. We reduced it, I believe, by 8.25%. But there's a whole raft of items, and again, I could hand it over to either one of my ministers, Minister of Economic Development or Finance, because they're heavily involved in making sure that we have our companies, especially our small businesses, thrive and grow. And I can tell you one thing, Mike, we're going to get back to that point. It may not be tomorrow, but I have all the confidence in the world and the businesses here in this province and the creativity, and we're behind them. We're going to have this economy humming again. We're going to have it moving forward, and we're going to continue supporting small businesses. Matter of fact, we're going to be supporting all businesses. But let me hand it over to one of the ministers.
Well, thank you very much. So the Jobs and Recovery Committee is fanning out throughout Ontario with all of our stakeholders right now and all of the groups to give us their feedback on what they believe are the next steps that we can take to help the economy recover. But think about where the Premier was going. Think about where we were just before COVID-19 broke out. We had seen the economy create more than 300,000 jobs. And the biggest issue we had in our economy was trying to fill the remaining 250,000 jobs that were left unfilled at that point. So we know that once this is over and we begin to regroup, that our economy will come roaring back. But to help it along, for instance, one example is our Ontario Together Fund. It is a $50 million fund. As the Premier said, this is for PPE, the personal protective equipment. We know that we weren't making enough of it here in Ontario before COVID-19, and this is a program to invest $50 million for companies to be able to retool or to buy new equipment to make PPE, a business that we want to get into to satisfy the Ontario market, the Canadian market, and export. And there'll be more businesses like that.
Next question.
Next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hi, Premier. This one's for you.
Hi,
Maybe could you give us a little hint about the next businesses that might be on deck to reopen after this? And my question as well is, if I know Ontario seems to be in a downward trend again, we might be in day 6 or 7 of steadily going downwards. However, in Toronto, it's still facing the biggest number of cases. So when you do start to open up the economy, could the City of Toronto add some more stringent restrictions than you might have elsewhere in the province? For example, opening restaurants later?
Well, before we open the whole economy, I'm going to stick with what I've always been saying. We're going to follow the framework and the guidelines, and until we see a downward slope right across this province for at least a couple of weeks, we can't open up the whole economy. I know on a daily basis, because I asked again today, not to mention I talk to Mayor Tory quite frequently, but I asked again last night and today, are you in full contact with the mayor's office? And they said numerous times, we're going to work with them to make sure we're collaborative and we open up Toronto as much as possible based on health and science. And I'm never going to waver from the health and science part of it. And I know the chief medical officer, we've set guidelines and the framework and worked with the health team. And we have pretty stringent health guidelines, and the Minister of Labor worked on that as well. So we're going to do everything we can, Cynthia, to see the economy open up. But again, I'll stick with what I've said before. Let's see 2 weeks of real positive results.
Okay, thank you. And I believe the finance minister would be best for this next question. It's kind of a continuation of what Haley Cooper was asking regarding landlords who are trying to get their rents lowered under this federal policy. What if, or tenants, I'm sorry, what if landlords say no? Does a tenant, it seems like the tenant has absolutely no power in this. And why hasn't it been done so that they could have a say and they could buy into the program, even if their landlord is not?
Yeah, so a really good question. There are 1.2 million commercial leases in the province of Ontario. And of course, this program is national, so imagine that's 40%. There are millions of those leases across Canada. The program the federal government designed with all the provinces targeted the landlords because that was the way to get the money into the system most quickly. The vast majority of landlords, of course, have a mortgage, about 97%. And so that's why Canada Mortgage and Housing, who have the insurance for those mortgages, was the right group to work with those landlords to put it into place. So the reason was because we wanted to move quickly and we want to make sure that people are getting that relief. The reason it was announced last week is because we recognized that May 1st was coming up, and so that both landlords and tenants would want some certainty. And of course, remember, it was for $50,000 and under, so targeting smaller businesses and those landlords. And again, this was a program designed to move quickly, to get money out there, and designed to support both the tenants and landlords. But we're confident, as the program, and as I said, the federal government is committed to actually having the program available end of next week, that will relieve a lot of the concerns. And I do have to say that the federal government has been listening. We've been getting certainly feedback from tenants, something from landlords as well. We want to make sure the program fits. We want to make sure most of all the money, almost $900 million in Ontario support, gets out there as quickly as possible.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, my question is first for the finance minister. Just building on the question from Mike Crawley about the CD Howe Institute saying we're in a recession. I just wanted to hear from you. So you're obviously tracking all of these numbers. Do you believe Ontario is currently in a state of recession? And will there need to be further stimulus when the state of emergency is eventually lifted?
You know, CD Howe did make that comment today. They took a non-traditional perspective in terms of other factors looking at whether we're in recession or not. Of course, the traditional definition, which is one we would use, is 2 consecutive quarters of negative growth. But beyond the name and the title, what we can see quite clearly and what you've heard from this podium day after day is an understanding from our government that people are hurting, businesses are hurting, and individuals are hurting. And I'll refer back to the conversation and the really impressive dialogue we had with Governor Polos today. He used an analogy. He said it's as if you're going along on a flat surface and then you come to a crater or a hole in the ground, and that's this economic downturn. What governments are doing, what our government, the federal government, municipal government are doing, are filling that crater. Otherwise, we'd have to go down into that crater, and that's not where we would ever want Ontarians to be or Ontario businesses to be. So the supports we've been providing, $17 billion so far in direct and indirect support, have been to fill that crater so that we can have a bridge to get across to the other side. There's no question that we are in unprecedented times, and not just here in Ontario, but around the world. But our government's committed to doing what it takes. You asked about stimulus. We will talk about a recovery phase. As you know, we had, unlike any other government, we made a decision to make updates to our financials. So unlike other governments in Canada, we did that at the end of March. We said at that time as well that in the fall we'll bring out a full budget, and we're working daily with the federal government and with my colleagues, as Vic mentioned, with the Jobs and Recovery Committee, talking to Ontarians, finding out what's going to be necessary to get the economy back on track. But quite clearly, we're in difficult times. The work of all of us and the work of all Ontarians is going to be get out of that as soon as we can.
All right, thank you, Minister. And to the Premier, Premier, today the long-term care sector in this province reported 3 more homes have declared an outbreak. So these are homes that didn't have COVID-19 before, and now they do. I'm a bit confused. I thought the province had created an iron ring around these homes. If that's the case, how is the virus still getting past the iron ring?
Well, again, I'm going to give it to the expert here and pass it over to the Minister of Health.
Well, we knew that there was a potential for this to happen, that we know that long-term care homes are particularly vulnerable as are retirement homes and other places of congregate living. So we're going to continue with our efforts. We want to make sure that within 2 weeks we can have everyone tested in a long-term care home for COVID-19 so that we can isolate them to protect them and to protect the other residents of the homes. But very clearly, there still is a lot of work to do. That's why we're very grateful for the assistance of the armed forces for coming in and helping with 5 of the homes. That's why we're grateful to the hospitals as well for partnering with many long-term care homes to send in their staff to make sure that they can do that infection prevention and control, that they can care for the residents, and that they can isolate the ones that are able to be isolated, or they will be sent to hospital for treatment. So we're not through this yet. We've said that we're not through the peak. We know that we need to pay particular attention to long-term care and retirement homes, and we're going to continue to do that until we beat COVID-19.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Good afternoon, Premier.
Hi, Sean.
Wanted to ask you today about the reopening announcement, and I'm wondering when the point arrives where childcare centers across the province have to be reopened in order to ensure that the full economy of the province can begin to function. I mean, presumably the workers who are going to go back to these places on May the 4th will need childcare, and it may not be available to them. So at what point do you have to reopen childcare centers across the province just to get the economy going again?
Well, our number one priority for all of us in Ontario is to protect our children. That will be our number one priority. Again, we'll get the advice off the Chief Medical Officer. We'll look at the curve to make sure it continues to go down. But I know the Minister of Education, Minister Lecce, has a plan, and as soon as those numbers hit the appropriate place, then we'll be able to have childcare again. But Sean, I fully understand what you're saying. If they're going back to work, someone has to take care of the children, and it's going to go hand in hand almost. Where again, we have to see 2 weeks of a downward trend, minimum, by the way, before we open up the economy. I've said from day one we're going to open this up in a trickle, which we're doing, and mostly seasonal items were opened up today. But everyone's doing a great job, and in the public, we're seeing a positive trend. But again, we want to see at least a couple weeks.
Premier, another one for you. I know you get this question probably every Friday, but we're about to have probably the nicest weekend of the year. I'm wondering how much you're concerned that people might just ignore social distancing, quarantine requests and head out there because frankly they're just too frustrated with the situation.
Yeah.
And is this going to set us back in terms of the ability to reopen the economy?
Well, even when we open up the economy a little bit, Sean, people have to practice social distancing. They just have to. We've come all this way, and everyone's worked so hard. Why go backwards based on having warm weather? That time will come, and hopefully it's going to come sooner than later that we can open up some parks and other recreational areas. But even when we do, you have to practice social distancing. Just because we open things up, no matter if we open up the economy or parks, again, you have to make sure you social distance until we get way ahead of this. And we aren't even close right now. It's still right on the front doorstep. We have to be super cautious, and until that happens, just please practice social distancing. We're getting there. We are getting there, and I'm feeling positive. So just hang in there for a little bit. We're almost there.
Last question.
Last question comes from Randy Rath from CHCH TV. Please go ahead.
Hi, Premier.
Hi, Randy.
There's a situation in the city of Burlington where the city has said that you can't have a drive-by celebration of a birthday or an anniversary or something like that with any more than 5 cars, because they say that it constitutes a parade and your emergency measures make it so that you can't have any more than 5 vehicles in a parade. Is that not taking things to the extreme? What harm is there in people inside their car honking their horn with more than 5 in a row going by somebody's house to celebrate their birthday?
Randy, I agree with you. If everyone's in their car, who are they bothering? You have to celebrate a little bit, going around. And I'll leave that up to the mayor of Burlington. But I spoke to Jane McKenna, our MPP out there today, and she's doing a great job, by the way. And I said, what's going on with us? Why? They aren't hurting anyone. They're in the car. They're going by, and again, she doesn't disagree. But I guess someone has to have a conversation with the mayor of Burlington. That's going to be really up to them. But let's be a little lenient on stuff like that. I'd understand if there's groups of people marching down the street side by side, chanting, but that's not the case. They're in individual cars driving by. What does it last? A few minutes? People honking their horns. People need a little bit of freedom to get out there and celebrate. But that's a judgment call for the mayor.
Okay, and outside of the city, nurseries and greenhouses are already, and they have been since Easter, operating sales at the end of their lanes, and golf courses have already started grooming the courses for opening. I'm wondering what's different in what you're talking about today to what's already happening, and is the people that run those businesses ignoring the emergency measures, legislation, a factor in what you're announcing today?
Well, as we all know, garden centers are very seasonal, and we have to get the flowers out there. We're talking about individual garden centers attached to other big retail. But my heart always breaks for the little guys. The little garden company that's somewhere in a small town, standalone. Those are the people I love. I want to support them, and anything we can do to support them. And as the trend goes down, hopefully there'll be a time in the very near future people can go in and look at their annuals or perennials and pick them out. But right now, through the advice of the chief medical officer, I just feel a little better, a little safer just on curbside pickup. But do you know what this does, Randy? I think it's really good for mental health. People get outside, they get to garden, make their place look nice and bright and beautiful. There's nothing better than a beautiful garden with flowers, as my mother always told me. So,
Thank you.
thank you. That's it. Well, have a very safe weekend, and God bless everyone of Ontario. You're absolute champions. Thank you.